Hey team, welcome to episode 130 of Transition Talk, where we talk about dental transitions and how to navigate the sometimes messy path to practice ownership. For new dentists, the transition from dental school to working in a practice is an exciting and sometimes scary time as you finally kick off your career you've been planning for what feels like probably ages. For practice owners, the transition of bringing on an associate signifies a period of growth and opportunity, but also can be pretty scary. And even more, working for a practice where your dad is the owner or bringing an associate who happens to be your son, this can all add up to an exciting period in life with plenty of opportunity for the future. So, to give their real-life perspectives on this new phase in their careers, I have the pleasure of speaking with the doctors of Butterman Dental in Centennial, Colorado, Dr. Dan Butterman and his son, Dr. Kevin Butterman. Dr. Dan Butterman has been practicing dentistry for more than 30 years, started in a practice in '94 as an associate with his dad, and has been practicing ever since. Dr. Dan is also the Chief Dental Officer of Spear Education and Faculty Chair and Resident Faculties at CDOCS. Dr. Kevin Butterman graduated from the University of Colorado School of Dental Medicine in 2024 and joined his father's practice shortly after. He comes to the practice with experience in treating patients at school clinically, as well as a number of community-based health clinics throughout Colorado. So, welcome, Dr. Dan and Kevin Butterman to Transition Talk.
Thank you, Christy. Appreciate it. Thanks for having us here.
Of course. I love a good family transition. Lots of dynamics, lots of things. Dan, you've been through one already with your dad. How was that?
Coming out swinging with the hard questions right off the bat. I love that, Christy. Like if I could be brutally honest, like I don't want this to turn into a therapy session,
No.
but it wasn't wonderful. Just that my dad came from a different generation and did things a little bit differently. So the transition basically was him deciding what the value of the practice that he thought it was, because he built it from the ground up, and me saying, sure, that sounds good, and signing something and writing checks for a lot of years. So there wasn't really a lot of thought put into it. There was no malice in it. It was just, this is what I think I want to get paid, and my naivety just saying, sure, okay, let's do that. So that was my background and my learning on practice transitions.
Yeah, very interesting, because as we talk about, clearly we're going to start the conversation. I started with that, but we're going to go back to kind of bringing on an associate. But anytime I get a call from any related parties talking about transition, my first kind of comment is always like, family and business is hard to mix together. And sometimes transitions in between families just have a different dynamic. And it's not, like you said, it's never like malice or bad. It's just sometimes two different generations. Sometimes personalities are too much the same or too different. And so it just adds a different dynamic to it that, has to be kind of discussed, especially as you guys go into partnership or, have a transition down the road. So we'll get there here in a minute, but let's start with associateship. So remind listeners, you started about a year ago in the practice, Kevin?
Yeah, so right after I graduated, I had about a week between graduation to relax, and then
I would have preferred 2 days, but
back in it.
Yes.
Yeah.
Okay. And so Dan, tell us about your experiences. Have you ever had any associates in the practice before?
Yeah, I have. I've had associates over the years, and like it very much is like a marriage, and there's just a lot of similarities that you have to have with an associate. And I think when you have a good associate, when I say good, somebody that shares the same ethics, same philosophy as you do, like it can be wonderful. It can be collaborative. It can just be a tremendous experience. When that doesn't happen, you hate coming to work, and it just can be super negative. So I think working and finding the right associate it's critical.
Yeah, absolutely. So what was your experience with Kevin coming in as your son? And I have a question. Do you say Dr. Dan or do you say Dad?
No. He calls me Dad, and
okay.
I love it. Like,
when I'm nice, I call him Dad. Usually it's the old man.
Yeah, usually.
Old man. I love it. So what was it like bringing Kevin in after bringing in other associates? How was it similar? How was it different?
Well, I will say that while I have had good experiences with associates in the past, I would say that it wasn't good enough. So I made the decision that I had to make my own. And so that was, Kevin was 27 years in the making as being an associate. But it's different because you bring in somebody new, especially a new graduate, and they're going to have a certain level of education. They're going to have a certain level of confidence. There's going to be coaching and teaching that has to happen. When they are related to you, when there's somebody that you love, when they're your son, you tend to have much more patience, and you tend to, like, listening to Kevin talk to patients and watching him perform as a dentist. It's emotional for me. Like I love that. So I think that it's probably quite a different level and a different experience bringing in just an associate versus bringing in a child as an associate, or not a child, but an
your
adult.
child always will be your child. You can say that. And Kevin, what about you, right? Like we've finished school now and we're kind of going into real life. You've clearly grown up in dentistry, but what was it like to join Dad's practice?
For me, I've always said I'm the luckiest person to be able to have this to go into. I mean, school is its own beast on its own, and trying to navigate the real world going into dentistry, figuring out who you are as a dentist, that's such a scary thing. And to have my dad by my side to guide me through this whole journey has been nothing short of just incredible. So lucky to have been able to go into this with him.
Nicest thing you've ever said to me. I'm blown away.
And you have it recorded. You can just
Yes,
play it
yes,
every
I'll need a
time.
copy
Just
of
make
that. Yes.
make a soundbite. Do you feel guilty when you talk to your other colleagues who are trying to find associateships and trying to find the right practice and negotiating agreements? I'm sure there's a little bit of guilt there because you're like, I didn't have to do any of that.
A little bit of guilt, but a lot of like feeling grateful that he's paved
Yeah.
the way for me
Of
and
course.
giving me this opportunity.
Oh, that's awesome. That is awesome. So from, as a father-son duo, clearly there's an established doc, new doc role too, right? Just from that. But how does your dynamic work in the office? Was there a lot of shadowing? Like, what did it look like, those first few weeks as you just got your feet under you and you kind of said, okay, now there's two of us and how do we work together?
I'd probably say the most worrisome piece of it, whenever you bring in an associate for that matter, is that you have to introduce them to patients. And the patients, in my case, the patients were used to seeing me for many, many years. And if they wanted to see a different dentist, they would have changed dentists. So the intent was to continue to see me. So how do you introduce an associate into that environment and make it so that the patient accepts that? And so I thought the way we did it was pretty helpful. So Kevin decided that he was going to be a general dentist and not specialized, but he didn't realize that I was actually going to make him specialize in recall checks and MODBL composites for quite a while. But we thought that would be a really good way to introduce him to patients, is that he would take over the bulk of the recall exams, just get a chance to meet the patients, have a conversation with them. And that seemed to be a really easy introduction. I'll let you speak to transitions and some of the things that you did coming in.
Yeah, I mean, from day one, right when I got here, every hygiene check, he somehow was busy. So I was seeing every single patient for the hygiene checks. And it's so nice having these patients understand that it's a family practice. So coming in there, when I say I'm the son of the other Dr. Butterman, I say the old guy, they're always so excited to see that it's a family member coming in. There's, of course, a few who are cautiously optimistic about it, but everyone from that moment forward was so grateful to have a family member that they're seeing rather than just some person they found on an ad online to come work for them.
I was just going to add on it. And to be fair, Kevin didn't just come in just straight out of school as a lot of kids do. We had the luxury of sending him through Spear Education and CDOCs for a bunch of programs and a lot of education. So he was kind of ready to hit the ground running when he came into the practice. And I think that level of confidence that gave him kind of showed through, whereas maybe a brand new grad without that confidence might have been a little bit of a harder sell.
Yeah, in school is you see one patient in the morning, one patient in the afternoon if you're lucky. You don't really have to do much of the treatment planning on your own, patient discussions on your own. You have a faculty there with you at every point to guide you through that, and to go out into the real world and have to have these discussions on your own, make these treatment plans, present them. With the dental school experience, it's very scary. So to be able to go through this education before with Spear and CDOCs and kind of hone in those patient communication skills was super, super helpful.
Yeah, I think the human component of any kind of service business, including dentistry, like the communications you're having with patients and the building those relationships and the communication of that treatment plan. And here's what we're telling you need to do. Like, you have to have confidence in that. And that clearly comes through as you talk here, and I'm sure helps from a patient perspective. What about the team? Clearly, they knew you were going to be coming on. They have a lot of respect for you, Dan. Was there a communication, or kind of how do you guys handle the team? Doctors are leaders of it, regardless of ownership. And so how do you guys handle that?
It was a little bit of a problem in that they liked him better than me right off the bat because he was the nice one. But aside from that, I think there was excitement from that side of it as well. There's some fear also because things are going to be done differently and decisions are going to be made differently. And so there's always a learning curve with the team. But I think that one of the things that Kevin said, it was actually, we were interviewing for a new assistant and she came in and he was sitting and talking with her. And he said, in this office, we're all the same. We all have the same voice. We can all be a part of everything that happens. Nobody is above anybody else. And I think that's sort of the way that we've always run this practice. Of course, there is leadership, and of course, there's a hierarchy, but nobody's afraid to say what's on their mind or to talk about or to share their opinions. So that open dialogue, I think, was critical, because if you don't share that with the team, here's the expectations. Kevin's going to be slower than I am. The procedures are going to take him this amount of time. He may see things differently. What do you do when he sees something one way and you're used to seeing it a different way from me? So like those were the conversations that had to happen with the team. Otherwise, it's an unknown and it's scary for them.
Yeah, 100%. That communication and just everyone feeling like they have a voice and are part of that team is so critical in any kind of transition. So it sounds like hygiene checks, we're doing all of them. We've got those patient relationships. Your first patient that you were like kind of going to do the production, did it happen naturally because you just had this, relationship with this patient? Did you call in sick one day and say, here you go? How did it work?
I can't remember exactly, but I'm pretty sure I just walk in the room, say I'm Dr. Butterman, the son of the other Dr. Butterman. I'll be doing your treatment today.
That's not how I remember it.
Really?
I knew there was a story. I could see the smile.
I was probably too stressed to even remember what happened.
Oh, you were stressed. The way the story actually goes is that he hadn't actually graduated yet, and I had a recall exam.
True.
And I saw a cavity on tooth number 2 for me, and I'm like, oh crap, wait a minute. Kevin's going to be coming in a few months. I think this would be great if he did a filling for me. So I was his very first patient. For me, I'm like falling asleep in the chair while he's doing it. He's so stressed out, like so worried about every step of the way. I'm like, Kevin, you're doing a filling. Just do the damn thing.
I think I took a picture of my prep to show him while he was laying in the chair.
Minutes. So me being the first patient, as patient 0, he kind of got rid of the most anxious, the most anxiety type of a procedure that you can do, not just being on your parent, but being on your boss, I guess. And so once he was past that, the actual first patient you saw became unmemorable at that point.
Yeah.
And then you could actually say, he does all my work. And so like,
yes.
you gotta, like, we trust him.
It was one.
Yeah, we got it on the record as well. So we talked about CE. Clearly that has helped you bridge the gap from dental school. I'm assuming continuing on with CE, kind of learning about that. There's always in a relationship, partnership, marriage, whatever we're gonna call this, there's always a learning component. What have you guys learned from each other? You're only a year into this, but what have you learned from each other in this last year? I'd love to hear that from both of you.
I think what I've learned from him is dentistry is a very stressful profession to be in, and he's found so many ways to make this profession as little stress as possible. Little tips and tricks that he has, to whether it's as easy as this is going to be a pain procedure that I don't want to do. I'm not going to make myself suffer through this. I'm going to refer it out. I feel like coming in as a new grad, you feel like you have to do everything. But I think it's very grateful that I've learned this lesson early on, that there's no need to beat yourself up over something that someone can do much easier than you as a specialist and refer that out, or to just be honest right away with your patient. If you see something that goes wrong, like there's an open margin in your crown, there's a void in your filling, if you go home and leave that without saying anything to your patient, you're going to lose sleep over that. Patients love the honesty I've learned from him. Just tell them right away, I see this in my filling, I see this in the crown, I'm going to redo this for you. I'm sorry it's going to take a little bit longer, but I can't allow this to go out the door. And just being honest and upfront right away, I think has taken so much stress out of what could be a stressful thing.
Really, really good points. And I'll add on top of that, and that, while Kevin's clinical skill, his hand skill is unbelievable. And I say that, of course, because I'm his dad, but I also say it because it's true. But then I forget, because I've been doing this for so long, and you forget about the technical skill and the ability and the focus and concentration that comes in from even doing a simple procedure at a very high level. And dentists are their own worst critics. And the thing that really I focused in on is that when something wouldn't go well for Kevin, as it does for all of us from time to time, he would beat himself up over it. And that's hard because it's a really long career. And if you take everything to heart, if you let it eat at you when things don't go well. So what I've tried to instill, although of course we're shooting for excellence, we're always trying to be the best we can. There are times when on this particular day, on this particular patient, in this situation, that was the best I could do. Not the best I can do in any situation, but on this patient under these circumstances, good is good enough sometimes. And we have to be okay with that. And I think that's really important to understand, that we can always strive for more. We can always do more. We can always do better. But when it doesn't go as well as we wanted to, we've got to be okay with that too, because that's just life.
Yep, 100%. I love that. I say that to myself every day in my car. I was the best I could be today. I
Yeah,
gave my best today that I have.
it's so important to accept that.
Yeah, I love that. On the CE track, I want to hear from both of you. And if it's the same, that's okay. You guys can just say you're the same. But what CE, if a new grad or someone who is a D3 or D4 is listening here, what CE doesn't have to be necessarily a full program, but like what CE would you have them focus on now, soon after graduation, and maybe in that first year to help set them up for success?
So for me, at least right out of graduation, what I did was, well, in school, it was very heavy analog focus in terms of crown preps and all that. You take your impressions, send it to the lab. So coming into a fully digital office, it's a huge change in workflow. So being able to take these CE courses with CDocs and learn how to do this digital workflow and being able to hit the ground running right away and scan, design, mill my own crowns without needing help from the old man here was such a valuable thing for me. And then the other thing, like we talked about earlier, was just the patient communication, practice management. Having 1-2 patients a day, if you're lucky in dental school, is very sheltering. And then coming out and having to manage and deal with all these patients, learn how to communicate with them, learn how to present. Taking CE on practice management, I took a course with Spear, and that was just unbelievably helpful in helping me merge into this practice.
Yeah, really good thoughts. And I mean, some of it's obvious, some of it's less obvious. And I would agree with a lot of what Kevin said. I think always there's going to be help on the hand skill side. And I don't mean this in a bad way. It's just the world we're in today. Post-COVID, there's probably a lot less hands-on clinical patient-driven procedures that are done from kids when they graduate school. Sometimes they haven't done many crowns. Sometimes they've not done a root canal on a living person. So being able to hone in on where there may be some gaps in the fundamental learning. And Kevin was able to fortunately go through some of those programs at Spear Education on that foundation side. And here's the best way to prep a tooth for a crown. And here's how you do it. When in school you had 4 hours, we want to do it in 20 minutes to prep the tooth. Like, how do we do that efficiently, not just do it in the best way possible? So that's a really important piece of it. The other thing is, and we've talked about patient communication, but you could be the best at diagnostic and treatment planning, but if you don't have a believable way of telling the story and building the story and discussing it with the patient and making the patient feel like this is the right thing for them to do and to understand it, you're not going to make any money. I mean, the reality is that the case acceptance, the treatment planning and the case acceptance, whether it's just a confidence thing or just learning the right phrasing and the right way to communicate, it's such a miss that a lot of people, and it's not just new grads, a lot of people are just missing that. And it's being a business owner or being an associate that is expected to produce a certain amount. It's not just the hand skills, the communication is equally as important. And I just add one last piece to it. Dental school is very tooth driven when it comes to treatment planning. Here's tooth number 2, it has a cavity. Tooth number 3 needs a crown. This tooth has a crack in it. That only gets you so far. And one of the things that I really wanted Kevin to focus on is more holistic treatment planning. Are all the teeth in the right place? Does this meet the aesthetic demands of the patient? Instead of looking at just one tooth at a time, let's treatment plan from a whole patient approach. And let's understand, are we looking at things from the right way? Because if we put a crown on tooth number 30, and then ultimately we make the decision that tooth number 30 was not actually in the right place, well, now we're redoing the crown, we're doing unnecessary treatment. So looking at treatment planning from a holistic instead of single tooth approach is something that we focus heavily on in our practice. And it's something that Spear Education in general really specializes in as well.
Very important. So you're a year in. Do you have CE that are, hey, these are things that I'm looking to do now that I've kind of got my feet under, I've got a foundation, I know how to talk to patients, I'm doing regular production. Like, what are you looking to do now as you approach your second year as an associate?
Yeah, Kevin, what are you doing next?
So I definitely want to get into the implant placement aspect of dentistry. But before I feel like I can dive into that, I really want to take a lot of CE on just oral surgery in general, complicated extractions, surgical extractions, get much better on that because I feel like there's so much more to just sticking an implant into the mouth. You have to be able to navigate these complicated situations. And because dental school, it gave us the basic foundation of it all, but I need to take so many more courses on actual surgical management of complications and many different surgical aspects other than just placing an implant in the jaw like they talked about in school and make it seem so easy.
Just put it in. It's fine.
Yeah, it's funny because the reality is there's only two ways to increase the amount of money you earn, and one is to do more procedures that you were already doing before, increase your volume, or add new services that you weren't doing before.
That was actually my next question. Are you guys looking to add procedures that maybe Kevin has interest in that you, for whatever reason, over the course of your 30 years have said, I don't enjoy that? Or is it just a continuation of what you already offer?
It's a good question because I feel like when you first start practicing dentistry, you kind of want to try everything. And then the more you practice, the longer you've been doing it, you start to realize the things that you hate most in this world, and you just stop doing those sort of things. So while I do a fair amount of surgery and implants are a big part of my business, I would like Kevin to focus heavily on the surgical side and understanding, because it is very rewarding, but there's a lot of risk involved in the surgical aspect of dentistry. And I do think that while there are wonderful specialists and it's important and it's critical to have these specialists that we can work with, there is a certain amount of specialty type treatment, whether it's clear aligners, whether it's endodontics, that a good GP should be able to keep in-house. So although I do those things here, I would like Kevin to really incorporate that into his day-to-day as well and just become as proficient as he can, not, again, being a specialist per se in any area. There doesn't need to be, because we work with wonderful specialists, but there's a fair amount that we can keep in office as well.
And there's also probably an aspect of that of just doing what you said, which is figuring out what you enjoy and what you're really great at and what maybe you're okay not dipping your toe into at all, even if you could keep it in-house.
Yeah.
So knowing what you know today, is there anything that you would do differently? Not to say that there's anything wrong with what you did, but is there anything that if you could go back in time, like I would spend a little more time doing this, or I might have done this in a different order from either of your perspectives?
I would have hired his brother instead. No. It's interesting because I was very hands-off on the education side when Kevin was going through dental school. And my philosophy was, man, dental school is rough. I mean, there is a lot of demands, and adding more onto somebody's plate probably isn't necessary. But I would probably say maybe starting some of the early education things on top, because when you're in school, you're so focused on the way they teach it to you that it might have been more helpful to understand a different perspective from an earlier point, that while you are learning it this way, there are other ways to do it that might be faster, more efficient, not necessarily better, but just different, and to have an open mind. So I probably would have encouraged Kevin to maybe pursue some of that earlier within dental school.
Kevin, what about you?
That's a fantastic point. I 100% agree. If I was able to get out and take courses, see different perspectives, because all the faculty in school, while they're all incredible, I feel like it's all very similar in how things are taught. You're supposed to do everything in this sequential perfect order, and they don't tell you about any other way to do it. So to be able to get experience doing other things, I feel like I would have been more well-rounded getting out into practice, and it would have been, not that it was a horrible transition, but a much easier transition, knowing so much more going into the real world. I think for me, my journey to dentistry, so I went straight through undergrad, right into dental school, and then right out of dental school, starting to work here. I think if there was one thing that I would do differently, it would maybe consider doing a residency, like a 1-year GPR between dental school and coming to practice, just to get more of that surgery skill and bigger cases before actually doing it here in the real world. But I think without doing it, just jumping in, diving in off the deep end has made me adapt quickly, and not necessarily a bad thing.
Yeah, I mean, arguably that would have been a disaster taking that year, because then who would have done all the recalls and hygiene checks?
Yeah, you wouldn't have a practice to join. It would have gone under.
Right.
No, I think what you're saying is what we hear from students and residents, and the practice management piece is also incredibly important. Just being able to start that process earlier, even if it's just communication and how to present things and just kind of that piece of it. I feel like on top of all of the demands and expectations that go into dental school, those pieces get lost as well. So I think those are great points. Before we kind of move on from associateship to transition, any final words or final words of encouragement? You guys have been very giving of advice, and I think that the young individuals listening to this will walk away with a lot, but any kind of final one-offs before we move topics?
Yeah, I would say that the thing that while you don't learn a lot of business in dental school, and you don't learn, well, should I take insurance? Yes or no? And if I do, which should I take? And how do you negotiate? Like those are things absolutely. And I think that's quite obvious. And I don't think anybody will misunderstand that they have that gap. The thing that is less obvious that I really want people to focus on is the leadership piece. Because just because you are in a leadership position doesn't mean that you are a good leader. And your team will smell that. So it's critical. And it's not something that comes naturally just because you move into that position that, oh my gosh, I'm the CEO of my company now, and I am the leader. I have to be the leader. Just because you've moved into that position doesn't mean you know how to lead. And I think that focus needs to be there. You need to take the time to understand, what does a good leader do? How do you manage people? How do you work with people? How do you encourage people, hopefully with more carrots than sticks? And I mean, how do you get through that? And again, it's a thing that isn't obvious. And I would argue that the vast majority of dentists that are practicing today are not necessarily the best leaders. They are leaders in their practices by position only, not by their actions. And so I think that's a critical piece that I would like people to focus on, whether it's through books, whether it's through education. There are a lot of resources for it, but learn how to become a leader before you need to be a leader.
I love that, because I 100% agree. I think the number one complaint we get from established docs who are transitioning out or kind of tired is they're like, I'm just tired of managing people. And I think that management of people, yes, are humans hard no matter what? Yes. But if you have a good team that you have built that trusts you, then there's a family aspect that comes into play there where you're not managing people. You are really working with people. Like you guys mentioned earlier, we're all one, we all kind of come to the table. And even though you guys are their boss, they probably do feel like they are part of a team versus it's us and them, which I think is so important. What about you, Kevin? Any kind of final remarks for new associate or new dentist who's kind of thinking about this and what's next for them?
Yeah, I think as a new associate going through it, I mean, I was so lucky to join my dad, have a practice where it's so low stress. I'm welcomed immediately. But if I didn't have this position to go into, something that I would look into, knowing what I know, is finding a place that really wants you to grow. I mean, I'm lucky to know a guy who's been able to help me get so much education after school, but just being in a place that understands where you're coming from as a new grad, understanding that you're going to need a little bit of extra help and willing to give that help. Like for me, I'm able to just scream across the office, yo, Dad, I have a question. And he's there in 2 seconds to come and help me out if I need it. So some office that genuinely cares about you and wants to help you. And I feel like that's pretty quickly recognizable in an office when you start working, just talking with friends. It's easy for them to tell if it's a place that actually cares about them and if it's not, and no need to make yourself suffer through working in a place that doesn't genuinely care about you. So really find somewhere where you know you're going to be a good fit, because you don't want to come to work dreading showing up every morning. It's incredible being able to show up, love the people that I work with, and be so excited to get here every morning.
I love that.
That's great.
I love it. That's so great. Listeners, I hope you enjoyed the Butterman story and about associateships and bringing on Kevin as an associate for Dr. Dan. And we actually have more in store for you. This conversation was really a good one. They have a wealth of knowledge. And so be sure to keep listening. Listen to episode 31 as they discuss the future transition to partnership. Also, you've heard a lot about Spear Education today and the need for CE. Spear Education is a great resource that provides several workshops, seminars, virtual learnings, pretty much anything you can think of, so you can thrive as a dentist throughout your career. Kane Waters and Spear have also collaborated to release an associate ebook, which is coming out soon, which provides actionable blueprints for investing in your professional growth. Be sure to take advantage of these great resources. So that's all we have for today. Thanks for joining us on episode 130 of Transition Talk. Listen in for 131. And as always, make sure to share the transition love for those who may not know of us yet, and subscribe wherever you listen to your podcast. Until next time.